Well, good morning, everybody that is joining us. And we are just right now starting to broadcast, and we are just going to wait for a few minutes for more people to join the conversation, and we are going to start probably in one or 2 minutes, okay? Thank you. Well, good morning, everyone, and thank you very much for joining us this morning. My name is Miguel Cortines. I'm President and Executive Director of the Canadian Council for the Americas, Alberta. And as you know, we are organizing these weekly chats, ¿Qué pasa in Latin America? Weekly chats, almost every Tuesday at 10 a.m. Mountain Standard Time. And today is May 4, 2021. And I'm very glad to be joined today here by my colleague, part of my board of directors, Damaris Zampini, that is going to be our host today. And also Dr. Neil Parsons, that is our guest speaker today. How are you, Damaris and Neil? Damaris, how are you?
We're doing great, everything great. I'm excited about learning here a little bit more than I know about Ambassador Dr. Neil, and looking forward to the questions that will come forward. Thank you.
Excellent, and welcome, Dr. Neil Parsons. It was my pleasure to meet you through Damaris, the introduction that Damaris made, and we're very excited about learning more about healthcare in Latin America and the Caribbean. And I read your bio that Damaris is going to share with all of us today, but it's very, very impressive, and we really appreciate your participation here. And with that, I just want to remind everybody that this weekly chat is about to make a conversation. Hopefully we can engage with you, and you can send your questions. You can use the Q&A, and at some point, if there is some chance, probably we can open the mic also for open questions. And with that, I'd like to ask Damaris if you can take please the lead and just introduce our guest speaker this morning.
Perfect. So thanks again, everybody, for being here today. And I am going to take a look at Dr. Neil's impressive bio. Of course, I have the pleasure of working a little bit with him on one of his various projects that he's involved in. So I'm lucky to have got to know him over the last few months. And so with that, I'm going to actually read a little bit about his bio. So Ambassador Dr. Neil Parsons is a diplomat, global health policy consultant, energy advisor, and management consultant. He is the co-founder and managing director of Parsan Cross, a Washington, D.C.-based global strategic advisory firm. He serves as a senior advisor at Dentons, world's largest law firm, and served as special advisor to the World Bank Group. He is the founder of Your 247 Doc, a telehealth company. Ambassador has many years of international business experience, executing many projects globally with a focus on the Caribbean and Latin America. He was the Ambassador Extraordinary and Plenipotentiary of the United States of America, Ambassador to Mexico, and Permanent Representative of Trinidad and Tobago to the Organization of the American States. He held the cabinet position of the Executive Secretary of Integral Development, OAS. He earned his undergraduate medical degree at the University of West Indies, where he graduated with distinction. a Master of Business Administration, where he had graduated at the top of his top student with distinction. He holds a Registered Financial Consultant degree, a CACM from Harvard University School of Public Health, and a World Trade Professional degree of ITM Worldwide in Sweden. He was awarded an honorary doctorate for education, culture, and humanitarian work from the Americana University, registered in Cambridge University in the UK, and the Congress of Mexico. Dr. Parson is the chairman of the board of the Global Alliance of Surgical Obstetric, Trauma, and Anesthetic Care, the G4 Alliance, chairman of the Global Gas Council, chairman of the International Gas Union, Global Ambassador Network, and a director of the Young America's Business Trust, YABT. He previously served as the chair of the Inter-American Council for Integral Development and chair of the Permanent Council of the OAS. He was the CEO of HealthNet Limited. He has the following recognition: Colonel Honorable of the Governor of the Commonwealth of Kentucky, Award of Leadership by the City of Philadelphia, proclamation of Ambassador Dr. Neil Parsons Day in the cities of Boston, Hartford, Doral, and Miami, Statesman Award of the Memorial and Congressman Payne, and the Key to the City of Broward County, Florida. He is an honorary member of the International Committee of HIV/AIDS on Capitol Hill, the Women's Foreign Policy Group, the American Association of People with Disabilities, and the Americas Society. Ambassador Dr. Parson is also on the board of advisors of the National Student Leadership Foundation of the USA. So with that said, I think he's been a little bit busy doing a lot of amazing things. Again, I'm very proud to know Dr. Neil, and I'm very excited about his presentation today. Thank you, Dr. Neil. I'm going to pass the mic over to you. I've got some itchy allergies going on, so I'm going to shut my camera off and listen in on all the great things that we're about to learn on technology, healthcare, and everything that is very exciting for Canadians to really understand and see where we can collaborate. Thank you.
Thank you, Damaris, and good morning, good afternoon, and good evening, wherever you may be listening from. It's a pleasure to be here. And let me just start by thanking the Canadian Council of the Americas, Alberta, for this session. And let me thank the membership and the members, subscribers who are active participants of this organization. It's always wonderful to have, a geographic concentration of like minds to work towards, looking at outbound business opportunities and also improving the lives of those around them. And it's always a pleasure for me to participate in groups like this, because it's a means to an end. My task here is fairly simple. It's to frame for you what we feel the healthcare outlook really is for Latin America and the Caribbean, and also a peek into the future. What does that mean for us, for citizens of the region, and also for business opportunities, particularly as it relates to those of you who are active in business in Alberta, and also looking for inbound and outbound opportunities in the area of healthcare specifically. It's interesting that the council has an interest in healthcare because the number one growth industry on the planet at the moment is healthcare. Believe it or not, it's number one. In fact, the only other industry that comes kind of close to it, but it's still very far from it in terms of growth, is the cannabis industry. So it's an exciting place to be. And of course, we all learned from the global pandemic what healthcare means and the delivery of healthcare services. Just to frame for you Latin America and the Caribbean. Latin America and the Caribbean, I come from the Caribbean, I come from Trinidad and Tobago. And the region, let's call it the Western Hemisphere, the Latin region, I'm not including the United States and Canada in this formula. I'm speaking from Mexico, go all the way down to the tip of Chile. We're looking at about 35 countries with many other territories. The Caribbean alone, for example, has 15 English-speaking countries, but a total of 28 countries in terms of which will include territories, sovereign states, such as Aruba, Bonaire, Curacao, Montserrat, Martinique, which are all territories of the Dutch and the French, etc. We are looking at about 650 million people, and we are looking at a GDP in total of about $7 trillion. That's a very sizable chunk of the global space. And it's important we appreciate that and the region of the world that we live in, because very often we look just north and we look towards Europe. But there's a huge market, and I've learned this from being in the United States for the last 11 years. There's often an underestimation or an intimidation in some instances of what North-South means and the ability to work with countries of the South. Right now, we're in a very interesting time. We know people are passionate about the future. There's a high level of frustration. There's a high level of disagreement. There's political consolidation we are seeing, especially in the face of a global pandemic. We have a lot of issues of climate change. We have a lot of immigration issues going on. And all this, just creates anxiety and uncertainty, and it affects business. It affects the way we project into the future. Not to mention, this part of the world, particularly for Latin America and the Caribbean, this pandemic has taken well over close to 900,000 lives in Latin America and the Caribbean. We had close to 27 million active cases in the region alone. And unfortunately, it concentrated in Brazil, Mexico, Colombia, Argentina, Peru. And it caused a great disruption in the provision of essential services. So essential dialysis, cardiac care, etc., all that has been put on hold in many instances. Some countries try to set up a parallel healthcare system to deal with it. It did not go well for many of them, and it really put a tremendous strain on the healthcare system, and it gave us an opportunity to study it, rethink it, retool it, repurpose it, and rework the way we staff it. And that's the opportunity at hand here for many of us. And what has really triggered, what that has triggered, is it has catalyzed the implementation of what I call digital healthcare solutions, digital healthcare, which is different from telemedicine and telehealth. And I really want to draw that distinction very early on in this conversation, because telemedicine means I take my phone, you speak to a doctor immediately, but digital healthcare refers to an entire ecosystem, and that's where the opportunity really lies. Interestingly, as an overview for the healthcare space in Latin America and the Caribbean, it's important to note that well over 140 million people do not have access to healthcare services in our hemisphere. And that's a lot. And some of the interesting changes over the last few years, within the last 5 to 10 years, the populations of various countries are living longer by an average of 5 years. And women are actually living a bit longer than men, which is also interesting. If I'm to zero in on the diseases, and I want to frame this for you because it gives us a peek into the opportunities. 82% of all deaths in our hemisphere is caused by heart disease and cancers. That's a lot. And about 10% of these deaths is caused by what I call communicable diseases. And it does not include, I'm not including here, COVID. COVID has really changed that picture drastically over the last year or so. And 8% of these deaths is related to violence. 4 countries in our hemisphere top the world in the top 5 for violence. Interpersonal death, El Salvador, Honduras, right up there at the top. And in terms of healthcare as well, it's important to note a great percentage of our population is overweight. Obesity is a serious, serious problem, and that precipitates a number of the disease conditions we have in the hemisphere. About 35% of our population do not engage in any sort of activity, physical activity, I mean. There's a high level of smoking. 1 in every 4 men smoke, 1 in every 5 women smoke, and there's a high level of alcoholism. And why am I mentioning this? Because it affects healthcare outcomes. It affects how we spend on healthcare. It's important to note as well, our healthcare, in terms of healthcare spend, we spend about 6 to 17% of our service sector spend in terms of GDP, understanding that in our hemisphere, up to 65% of our GDP is service-based. So about 6 to 17% across the countries. Number one in terms of healthcare spend in the hemisphere is actually Uruguay, and the lowest is Venezuela, unfortunately. And the market for healthcare services for the Latin American and Caribbean region represents about 9% of the total global health capacity. That's a lot. It's important to note that about 8% of the population of 16 countries spend about 10% of their total income on health. That's a big spend across 16 countries, and that represents a lot of opportunity. And also, because of that spend, close to 2% go into poverty, because a great percentage of our hemisphere, people in the hemisphere, are not insured. And when a catastrophic healthcare event takes place in the family, it impoverishes the entire family. And sometimes it takes a generation to recover from that poverty trap. And why am I mentioning this? Because it impacts our ability to solve that problem. In the hemisphere, we also have a problem where the healthcare sector is tremendously underfinanced. The percentage of spend of governments in the healthcare space is low. There's vast room for improvement. There's a high level of deficiency in the delivery of healthcare service. There's generally a lack of coordination, generally. There's a high level of duplication of services where ministries and even state agencies overlap in responsibility. And about 36% of the healthcare dollar that's spent in Latin America and the Caribbean is waste. In other words, 36 cents in every dollar being directed towards healthcare is waste. And that's alarming. A lot of the countries are actually going through a very, very slow process of healthcare sector reform. That's a word that a lot of businessmen like to stay away from, but it's essential because you put the proper reforms, legislative, another, it could become a tremendous enabling environment for investment. If one of the biggest hurdles to the ease of doing business in many of these countries is bureaucracy and the legal environment to operate. So with reform, hopefully would come these changes. And the region is tremendously understaffed. We have 2 doctors for every 1,000 people in Latin America. And and to benchmark that, the World Health Organization recommends 2.75. We are 2. And in some European countries go at 3.5. So they're above the WHO recommendation. We are low on nurses. We only have 3 nurses for every 1,000 persons. In Europe, it averages about 9 nurses for every 1,000 persons. So you see the discrepancy, 3 times more. We have a tremendously low level of hospital beds. The lowest in our hemisphere is in Haiti, where it's dire. So I don't want to harp on the challenges, but in terms of trying to fix this and looking at business opportunities, we also have to look at the infrastructure around this. There's generally a poor telecommunications infrastructure. There's a fragmented healthcare service. And when I say infrastructure, there's low on bandwidth. It's not affordable. There's a low number of internet service providers, so that's a huge opportunity. The level of telephony penetration is fairly low, so there's a vast opportunity for improvement, and therein lies a business opportunity. But interestingly, in some countries, especially the Caribbean, there's a higher rate of smartphone penetration than there is broadband availability. So these are some of the nuances you need to be aware of as a business sector, in studying these things and understanding the opportunity at hand, because it's not just about digital healthcare, providing a telehealth app or some sort of virtual service. It's the entire ecosystem around it where there's opportunity. Some larger companies, multinational corporations, try to deal with this by entering the markets, and we saw it in Argentina, we saw it in Brazil, we saw it in Colombia, in Mexico. This is fairly popular, but at the expense of local competition. And generally what that leads to is a lack of knowledge transfer, a lack of capacity building, and a lot of governments are now trying to legislate for this. A big problem we run into is what I call employee skills, training and development. The countries that have been able to do so successfully, Colombia is a really good example of this, Mexico is a good example, Brazil is a good example, is they have been able to have a very strong relationship between government and the business sector, between government and academia, in terms of education, in terms of science and technology development, where government was able to enable them. And there's a huge opportunity at hand for training and development of staff in terms of business. Some other shades of gray that we run into is what I call intellectual property, data protection, poor quality data. All this is super important for you as businessmen to see, if I can't rely on the availability of quality data, how would it inform my business decision? So there's actually a business opportunity in poor data, because there's a lot of governments are looking for opportunity to actually strengthen this framework for data collection and dissemination. Unfortunately, about 2 in every 3 public ICT projects fail. It takes a long time, it's very expensive, they deliver less than is planned. And generally, the tipping point for failure is the actual process of bidding, bid selection, and contracting is flawed. Because in many instances, local content trying to capitalize on the business opportunities, this doesn't have the bandwidth. So there's a lot of room for Canadian companies and many others to come in and assist them with that opportunity. And in fact, I would tell you, the sale of many of these local companies, on average, in terms of government contracting, it's about 70% of their business. So there's a huge opportunity in the market for active government contracts by actually partnering with local firms. Another major challenge is an overestimation in terms of results and consequent, unfounded expectations. So a big part of this enabling environment for you as businessmen is to be able to manage expectations with those who you are selling to. Now, what do all these challenges mean for us? What are some of the solutions we can offer? As business, it's important to tell you the digital healthcare space globally measures about 1.25 trillion pre-COVID. It's estimated now this is well over $3 trillion. And we saw some unicorns taking place. A good example for this is a company in the United States called Teladoc. Teladoc is now a $47 billion company during the COVID period. So there's a huge opportunity. And again, it's not just an app, it's not just the IT, it's the enabling environment around it. I think as business, providing part of the solution would also help reduce some of the barriers to entry for small firms locally by partnering with them, and also bringing these e-solutions, I call them, as part of an answer. But in providing these e-health solutions, you actually orbit into other areas of business, such as e-commerce and e-government. I have seen examples of health companies going into countries, and because of the ability to actually start a project, establish a proven model, government hired them from a development perspective to help them with e-government services and e-commerce services. So it's not just e-health, it opens the doors for other things. Web-enabled business and government operations, as we know, is very expensive. And just to give you an idea, in Latin America, when you go in, about 32% of your budget is actually just preparation, internal preparation. About 26% of that budget would be fees, including legal fees. So be prepared to spend that money. About 20% of that cost is internal management and process re-engineering. And then, of course, you have PM fees, preventative maintenance, and ongoing business fees at about 22%. What I would like to tell you is a lot of this, especially in the healthcare space and the digital healthcare space, has political support across many, many countries. And that's a super important point. Starting back as way back as 1998, there was a summit of the Americas where all the governments decided that they're going to hold themselves accountable and have the political commitment to align their agendas in the Western Hemisphere for digitalization of healthcare. And this dates back to 1998. And then subsequently, we had what was called the Brazil Communique, the Declaration of the Rio Group, and many other examples where there's political commitment. Why is this important? It's important from a funding perspective. And I could talk to you quite a while on funding, but it opens the door for how do you pay for all of this? Many, the concerns of the business sector is generally, I go in there, how do I de-risk my structure to facilitate a proven, a proven business on the ground and be sure I get paid. A lot of this requires 2 or 3 things. It requires you to understand very carefully the alignment of the political agenda of the government of the day and then the national development agenda. I often advise businesses, when you're going in, do your research, do your homework, understand how old is this government, how long have they been in office, when is the next election, what have they committed themselves to politically, what does their manifesto read, what did they promise the population, and how does that manifesto align with the national development agenda of the country? And not just the national development agenda. The national development agenda is driven by their international commitments. And why is this important? A lot of this can be paid for from what I call DFI and MDB funding, development financial institutions and multinational development banks. There's a wealth of funds and resources out there to pay for a lot of this type of work through the World Bank, through the Inter-American Development Bank, to the Latin American Development Bank, the European Development Bank, bilateral arrangements with countries. So as a business, it'll do you a great favor by doing your research, understanding where is the government going, what do they need to do, who do I need to partner with in the private sector, and how do I advise them to pay for this, not just go in and try to do business. And that's a conversation we could have under separate cover that will take us half day to talk about. But in the opportunity space, it's also important that by the year 2030, Latin America is going to be the most urbanized region in the world. In other words, people living in cities. And think of you living in a city, what do you need? So there's a rural migration towards urban environments. There's climate change. Latin America, by the year 2030, Latin America is going to be the most urbanized. It's going to be the highest growth in fintech and technology. And it is projected to become the world's breadbasket, especially because of climate change. And those are, 8-10 years from now, those are huge opportunities if you plan it well. And the biggest area that we spoke of in healthcare is all the opportunities in the digital ecosystem, from connectivity, any internet service providers out there, anyone who could put up poles, run lines, offer broadband, and diagnostics, those who sell and those who can distribute MRIs, CAT scans, beds, hospital beds, PPEs, diagnostic tools, especially virtual tools. Any businesses out there who can assist with inter-regional collaboration, because very often the buying power is concentrated in regional groups. For example, in the Caribbean, we have 14 English-speaking countries and a couple observers who are part of what is called the Caribbean community. And in some instances, they buy in bulk. So for example, during the COVID period, they negotiated as 14 countries came together and negotiated vaccines, they negotiated PPEs, they negotiated ventilators, they negotiated hospital beds. So it's important to understand this inter-regional play and how you can capitalize on it. A lot of governments need help in leading the change, actual consultancies. If you're a business consultant, a change manager, a change leader, that is a huge opportunity. There's a massive opportunity for legal services, advising governments, bringing best practice, and helping them frame their national legislation to facilitate an enabling environment. There's a huge opportunity for consultants and legal services and governance, because a lot of the time the laws simply don't exist. I own a telehealth business called Your 24/7 Doc. And for example, we were going into the Caribbean, studying the Caribbean market, and we have made some inroads. But a big part of there are no rules. So there's regulatory asymmetry. So my question then becomes, how do I work with government and also bring in the infrastructure behind me to help create the rules? Because the last thing you want to do is go there and set up a fancy business, have a very high capital expenditure budget, and you're shut down in a year because the laws changed. Leveraging technology is a huge one. From consolidation of smart devices in the healthcare space through various apps out there. That's a huge opportunity. And by that, I also mean the interoperability of digital healthcare is a big, big space. APIing into universal devices. A lot of governments are looking for that. A big part of this is also training, I mentioned. There's a huge market out there for firms that are able to provide training and development opportunities for staff, especially when you are nuanced and considering the local economic situation, the social issues, the cultural issues, the organizational factors. The more you can niche the training per government, per state, per local, even at the mayoral level, first town, the better off you are. There's also a very large market, especially in Brazil and Mexico, for branded generics. The laws have been passed in some of these countries where they don't go for brand name drugs anymore. They open up the market to generic pharmaceuticals, but branded generics. That's a huge space. I mentioned earlier the populations are aging. So, and believe it or not, Latin America is the fastest growing region in the world. And it's said by the year 2055 that they expect to have over 130 million people over the age of 60 years of age. One of the fastest growing markets is going to be the home care market. That's also a space I would focus on. Medical equipment, devices, and consumables. Today, that market is worth over 35 billion, and there's a lot of room for distributors in that space. A big market, especially post-COVID, because people are liquid. For those who can afford medical tourism, there's an expectation that the medical tourism market is going to explode. Pre-COVID, as recently as 2016, 2017, over 1.6 million Americans alone went to Latin America for elective surgeries, cosmetic surgeries. That market is expected to explode. I think, we could also look at artificial intelligence is now becoming a thing. Machine learning is now becoming a thing. But you need to be super nimble in the digital healthcare space. So I would also be looking at AI opportunities and machine learning, helping governments make decisions before things happen. That's a big space. Working with the right partners on the ground would be my parting words to you. Large insurance companies, any large subscription-based organizations would be helpful. Partnering with your local firms, as I suggested. These are some basic ideas I would like to share with you in terms of where I think the market is going and how we can capitalize on it. So, Madam Moderator, let me stop here for a minute and give the audience some time to appreciate what was being said and how we could probably develop it a bit further.
I know I've been taking a lot of notes here on my end, so thank you so much. I'm looking at the chat here, waiting for some of these questions to come in. So I do have a couple of questions for you.
Sure.
Just a basic, say I'm an AI company in Alberta that has a product that I believe truly is scalable and would fit in Latin America, for example. Say I've done, of course, it would be in English, but maybe I can translate it to Spanish or another language. But it's ready to go. It's ready to scale. What would be my first step that you would recommend for me to take to go to one of these countries? And which one should I pick first?
80% of your time should be spent researching, doing your homework, understanding the politics, understanding, where you are at. I mean, I'm assuming a couple of things there, which is a dangerous assumption. You know your business, you understand your costs, you know your ability to spend because this costs money. And within those constraints, if those are not issues, spend time, your well-served spending time studying the markets. Then I would look very carefully at the competitive landscapes. Who are my competitors? What are they doing? And if what they're doing makes sense and it's working, therefore, what is the imitability to enter that market by copying what they're doing? 90% of your time should also be spent getting the right partner and the right relationships, even before you spend $1. Who do I need to talk to? Getting the intel, leveraging your relationships, leveraging your Rolodex. Very often it's, I can give you an example. In when I entered Jamaica, the Jamaican market, for example, I was very fortunate to have worked with a gentleman who's the chairman of the firm I partnered with. And we understood each other, we trusted each other, we understood each other's strengths and capabilities. And they had a lot of market know-how, hyper-local knowledge, a wonderful Rolodex, and the ability to penetrate government was high. So I had that confidence to sort of partner with them. So I would say, doing your research, understanding the political agenda, what the government has committed themselves to. I would spend a lot of time on the World Bank's website, the Inter-American Development Bank's website, the CAF's website, understanding what monies are out there to fund this. Because very often when you go to, if you're aiming for a government contract, for example, the first question they will ask is, how are we paying for this? So if you go with a solution in terms of your technology or your business, but you also go along with the solution, you go with a proposal, well, Mr. Minister, here's how you can pay for this because the monies are out there.
Excellent. Another question, or I guess maybe a little bit of a point too. So, from what I hear here is I guess, build your relationships very early on before you even really step in and go spend any money, because I think that starts to create that foundation of trust. I mean, at the end of the day, people are in business with people. As much as we love AI and all types of technologies, we love to have that level of trust in order to move forward. Having also the various connections at government and other levels, which brings me to my question about hiring local. What are some of the past experiences that you've had in maybe doing a rollout or some type of implementation or company set up in a new jurisdiction in Latin America, where are there some recommendations around hiring local in order to drive your company forward?
Sure. And again, that comes back to my Rolodex and your Rolodex and who you may or may not know in the market. A really good place to start is your local consulate and your local embassy. So if you have interest in Mexico or in Argentina, in Uruguay, Paraguay, Bolivia, you ask for an appointment to meet the economic counselor. And you go in and you discuss the idea and their job is to really provide you with the intelligence. They would say, well, here are manufacturing association members, here are chambers of commerce, here similar to your organization, here are the organization members. And then very often you ask them, I would very much appreciate if you can put me in touch with somebody. This is what I'm looking for. And they normally, I've never seen it not work. They would normally put you in touch with the key stakeholders to talk to. So very often it opens a door to a trusted source. That trusted source may not have the answer for you, but it could surely point you in the direction. And I have found it is very, very helpful when they send an email on your behalf introducing, can you please have a conversation with Damaris? And we chatted. So it's spending a bit of credibility and political capital to facilitate a cold call, but it's helpful because you really start, because the energy and the money you can spend and the time you can spend cold calling, it's better you spend some more time researching, getting the right point of contact, that focal point, and rather than have a sniper attack rather than a scattergun approach. And that often leads to additional touch points and additional touch point. All of a sudden you have your own Rolodex within 4 months, 5 months.
That's a very excellent point. And actually, it's a little bit of a plug for CCA, because that is what these associations are meant to do, is to make those connections. And we as an association, for example, may not have all the answers, but I know for me personally, and then with my company, we have worked and leveraged a lot our federal trade commissioners, for example, and even within our own organization, one of my co-board members here sits in the Alberta government. Benigno, I'm not sure if he's on here today, but these are great resources because, again, this all takes time, right? It's almost an elaboration of the contents and the contacts, the right contacts that you need to have, and positioning it, because it can be, a little bit scary, but it is doable. And I guess the management of your business at home And your new business approach can conflict sometimes with the time because we only have so much time. And hence, again, some of these great groups that are out there. Another question that I wanted to ask, and then I'm going to open it up a little bit more for some questions here, is about how do you feel the readiness of digital health for the end user? So for example, there is an ease of access to information, and some countries, even in North America, for example, are still very paper driven. As for some countries in Latin America are actually mandated to be very digital right from the get-go. So they may never even actually see an actual paper form in their lifetime, as say a teenager, as they're growing into the next 5-10 years. How do you feel the adoption, and what are some of the key enablers that will enable that adoption in Latin America?
Sure. Well, to give you some context, I have probably traveled to over 100 countries and I've studied healthcare systems because of other things that I do. And everywhere I go on the planet, I see the same 4 problems: access to healthcare, affordability of healthcare, increasing demand, and a lack of clinicians and clinical services. And I could probably add another one: a lack of compliance and fragmented healthcare systems. In other words, even if a person can access the healthcare, half the time they don't listen to the doctor. I'm saying all of this to tell you, if we really want to fix the problem, especially with rural access, understanding a great chunk of our populations we are assuming they're enjoying what we have: broadband, a fancy phone, a smartphone, etc. Half the time it doesn't exist, but we more than half the time. So the technologies and the opportunities we are bringing to market to try to facilitate the end user must be nuanced to their own needs. So for example, I have a telehealth app. We can do video call, chat call, etc. But perhaps that may not be suited for a rural village in Bucaramanga, in Colombia, right? What do I need to do with my platform or my technology to get into that market? Instead of a fancy video call, I may need to put that access over Facebook Messenger or WhatsApp, even through 3G or 4G rather than, rather than LTE or 5G. So this is what one has to think through very carefully to facilitate the end user. Also understanding, and you made the point, chunks of the population are underinsured, no insurance, underbanked, no bank account. Therefore, how can I use the same dumb phone, feature phone, not a smartphone, the old school phones, and give them the same privilege? I call it a privilege, because for them it is. For us, it's a right. For them, it's a privilege to speak to a doctor even over WhatsApp because they have a 3G connection. That is how we have to think it through to really, really serve the social impact or opportunity here as well. I mean, I don't want to be altruistic because at the end of the day, this is a profit making for most of us, or for the business community. But I would plead with the business community also look at the social impact investment side of what they're doing to solve the problem, because it will return the profit manifold to you if you see the problem from that with those lenses on.
Excellent. I'm going to come back to a regulation and standards question at the end. But for now, I'm going to take a question here from Hector Romero. Hector asks, he is with SMPS Legal. He said, thank you, very interesting presentation. We are working with an American telemedicine company. What has been the experience of your 24/7 doc in the region when it comes to pricing of your platform? How do you adjust it to different countries?
Good question. I have found our product in the US can survive at about 25 US. We are a subscription-based business, so we can survive at about 25 US for 24/7 unlimited access to a doctor via telehealth platform. It's very low in the market compared to many others. I have seen companies at $50, $75, and with no immediate care. In other words, our platform, you call a doctor, ideally answers within the minute. We don't call you back and forwards. So a number of factors have to come into play for pricing. In the Caribbean and Central America, however, it's very, very difficult to go in at that price point. The average, you have to match your cost for a telehealth business to match about 75 to 80% of a doctor's visit to be competitive. Understanding that you're also taking away transportation costs, the time it takes to get there, the time to sitting in a waiting room, that has value. There's value to that. So in other words, our experience has taught us probably about 15 US per month is acceptable if it's a subscription-based business. And if you have a very high uptake to get the numbers, especially at a government level, you can probably get away with between 5 and 6 US per capita, per head, unlimited for the month. But again, the numbers have to make sense, and you have to know your own internal numbers to get it to that critical mass that makes sense for you. And I would also tell the person who asked the question, sometimes the path of least resistance is to give away a certain amount at the beginning to gain trust and credibility in the medium to long term. So even suggesting to governments, hey, I'm willing to do a proof of concept, a proven model in a hyper-local area, free of charge. Let me just try this out for 6 months and I can prove to you this is going to work, et cetera, et cetera. And there are multiple ways, and I'll be happy to talk to the person after.
Excellent, that's awesome. So back to the question around regulatory and standards, right? So of course, each country, and you made an excellent point earlier around, of course, there is per country, but also their affiliations, obligations, and other commitments they may have within the region, for example. But are there maybe a couple of key recommendations that you can provide around where do we keep an eye on regulatory around this ecosystem build? For example, there's a couple of databases out there that will sometimes come out with different projects that they're procuring for example. But are there some specifics around regulatory that you may be aware of that you can share, where we can keep an eye on what regulations are passing, which ones are behind, et cetera, please?
I mean, outside of you focusing and spending a lot of time researching the country you're interested in, which is obviously choice number one for understanding where the market is. Let me just safely tell you, a lot of countries don't have the regulations. It's now being born, it's now being nurtured. And given the speed of light of technology changes, for example, we were just the other day talking about FaceTime was a big thing, right? And today we're talking about machine learning and AI making decisions for you all within a space of less than a decade. That's the bullet speed of technological advances. I would put in a very selfish plug here. I am senior advisor to Dentons. Dentons is the world's largest law firm. I have not seen a more robust resource than going on their website and doing your research for digital healthcare. There's tons of resources on their website. It's dentons.com, dentons.com. Certain law firms have a great repository of information. If you go on the World Bank, the Inter-American Development Bank's website, the WHO website, they tend to be a bit more policy than they are legislation. And policy drives legislation. But understand there's a huge dysfunctional gap between policy formulation and policy implementation. And only after you implement policy do you legislate for it. You're talking a gap of anywhere between 10 to 15 years sometimes. So once you understand that, you will understand, you will be superly cautious in how you approach it.
Well, and then you certainly then have other layers of that, because within those 15 years, you have government change, right? At various levels, federal and regional, for example. So taking all of those into consideration, you can think about all of this and really just keep it on top of that as a full-time role, and to really understand what all those moving pieces, especially if you are going to focus on an ecosystem approach rather than, maybe a part of it. And so I guess that brings me to my next question, which you touched on earlier a couple times actually, around partnerships. Again, say I am a provider of, and for example, we do work with a company that has smart lighting that can be connected with IoT, and they are around smart city, circular economy, on or off grid, and they also provide connectivity. So if I am that person providing that one item, there again, it comes back to, who can be my distribution partner and so on. But have you seen examples of maybe, I wouldn't say failures, but maybe factors that may not have made it easy for companies to really penetrate that market in this space of digital, IoT, technology, and so on? What are some of the things that you've seen that are maybe a showstopper?
Well, I mean, if I'm to understand what the nature of your question, it starts with not having the right partner on the ground. Sometimes some of us were taught, don't trust your own shadow, and that's probably really good advice, simply because I would go in with a solid lawyer, have a watertight agreement, be very careful that this makes sense, and the agreement that you have, where is the jurisdictional coverage for this? That's the starting point, and having your agreements put together. And very often, I think many of us miss the boat. Exactly as you said, many of us, as you suggested, many of us go in there with the thought that it's a one-off sale. But there's very little value in having a one-time sell when you really calculate and you appreciate the lifetime customer value. So sitting and thinking it through, if I'm going in with a smart light bulb, do I just want to push light bulbs through a distributorship? Or do I want to create and sit and work through a syndicate, build my own consortium? So let me go and partner with 3 or 4 people: the internet company, a security company who controls a lot of contracts in the country, a good distributor, because the distributor can have the servicemen in there if something goes wrong. You build out the consortium, then you go to the market and say, hey, I have an idea, and I would like to put this together. In that way, you control the lifetime value of the almost a platform. And that's a totally different way of seeing it, rather than going in with a light bulb.
That's really great advice. I find that advice, I think, is something that, in my experience, has been a failure in folks trying to enter a new market, any market for that matter. In my experience, more in Latin America, and even from Canada to America, for instance, is building. There's a part of the relationships, but if you show up with a very thought through implementation of what it looks like to do all of this, and without missing parts, right? And the reality is that takes a long time. It takes a long time to build those, whether they're local ecosystem partnerships, or maybe some of them are local or not, or maybe they've done business in the area. That alone can take a good chunk of preparation time before you ever even make one first sale. So that's excellent advice. Now, I thought
sometimes you have to, just to interrupt you real quickly there, sometimes you have to build the plane while you fly it. Because while you're thinking all this through, things come in. I mean, let me go back to my simple light bulb example. Almost every country on the planet has signed the Paris Accord. And a big part of that climate change accord is energy efficiency. Energy efficiency starts in the home. So that lamp behind me there has an LED light bulb in it. That's energy efficiency. My point to you is, if I'm coming out to sell a light bulb, a really good starting point is to go to the government and say, hey, here's the cost of this bulb. Here's what I can charge you for this bulb. Give it away to the population. Let me help you go to the Green Climate Fund that's based in Singapore, to the World Bank. Get the funding for it. All of a sudden, your light bulb could be in every household in the country. So it's not just about getting a distributor. It's also thinking through way beyond the orbits of what the product is. What's the other sell? What's the the gender equity cell, the social impact cell, and then create a plan around that.
Yeah, there's huge value, especially, oh, that's really noisy. I apologize for that. There's a huge value that ties again back to the human and the social aspect of the business. And again, that's, it's not just let's go make a sale and make some money. It's the ROI, but also the ROC, the return on community, which is very, very important to some of us. And it provides for a much more sustainable business approach overall and for everybody. We've got one more question here, and I want to take a look at the time. We've got another 5 minutes. So we have a question from Hector Romero. What are the services or products that your company is providing besides telemedicine to move forward towards a general ecosystem for interoperable digital health?
That's a good question. I mean, we are looking at a number of things. To give you some examples, the center of telemedicine is the center of telehealth. Telehealth could be wellness, it could be pharmacy, it could be education, it could be a number of things, making a patient healthier. So I like to think of it as wellness management rather than telemedicine. So those are orbits that we are looking at as an example. So for example, when on our platform, we geotag the patient, so we know where they are physically located. We can pick up where the closest pharmacies are. And as a service, by the time the patient hangs up from the doctor, we have, email and online prescription. That's an example of interoperability. Another example is you can add a layer onto that by doing a home delivery service. That becomes a monetizable model. But not just that, using technology to bridge the gap of compliance. So if I need my patients taking 4 tablets twice a day, 10 and 8 o'clock, we could send notifications to them and link that to our pharmacy. So what that does, it creates an auto refill feature on the pharmacy end. That's a monetizable model. We could look at looking at education as an example. Very often I find patients go out there, they Google, they go on WebMD, and we are creating what I call a society of virtual hypochondriacs. Everybody thinks they have every disease in the world. So a big opportunity is to customize information and educational components specific for that patient. So if the doctor diagnoses me with atopic dermatitis, by the time I hang up on a telehealth call, I get a link and I click on that link. I get information on atopic dermatitis that's simple to understand, that breaks it down for me in a manner that I don't need to go and confuse myself virtually. But education is also a big part of the whole ecosystem. So there are many, many layers to this we could talk about at another time, but it exists. Miguel, I see your back on, I'm assuming Miguel, I see your back on, so I'm assuming I've expired.
No, we are very good time. So we have 3 minutes basically, but yeah, it's a very, very amazing conversation and obviously a topic that is very relevant. I have a quick question probably before we close, but what do you think for Canadian companies that are interested in doing business in this specific sector? What are the challenges or the opportunities considering the cultural differences between the North American system and the Latin American system, the values, the way that people is and regarding telemedicine, for example, we are going to put a doctor that is going to do a consultation in a digital way, but what are the challenges of the cultural aspects? I don't know, I am clear with my question.
Sure. No, we have encountered that issue, and it's very important. It starts, and I mentioned it earlier, there's a business opportunity in training programs, hiring local content. So for example, our model is, yes, we have a telehealth app, but a big key in our model is owning a local network of doctors, a local network of providers. So like there's probably a Spanish word for stomach. So if you don't understand that, the doctor would be lost. But a local doctor who's using the technology and capitalizing on the business opportunity presented from a Canadian firm will understand what the patient is trying to say. So that's why I rather give up piece of the pie very early on, but in the long run, it makes the pie bigger and wider for everyone to enjoy. Otherwise, you run that risk And the last thing you want, especially in the healthcare space, is to run into medical litigious situations that bankrupts your company because you didn't plan it properly.
Absolutely, absolutely. Well, with that, I think we are just coming to the end of this weekly chat. I want to thank Damaris for an excellent moderation and hosting this. Thank you, Damaris. You did awesome.
Thank you,
And
guys.
to you, Dr. Neil Parson, I think you are a complete expert, full expert in this area, and we are very, very lucky. I learned a lot about the different aspects in Latin America. We have a lot of opportunities for North American companies, Canadian companies to explore business in the new digital economy with all these tools that right now are available. There is a huge market there with a lot of issues, like you mentioned, the cancer, heart disease right now with all this COVID situation that is happening. And yeah, working with e-health, e-government, e-commerce, obviously be aware of the regulations in each of the different countries. Obviously the political aspects play an important role as well in all this area of opportunity. And for sure, so many opportunities. Thank you very much, Neil and Damaris. And just for all the audience here, please, next week we are having a conversation on Panama, and Damaris is going to be also our host in that one. Very interesting conversation about Panama. It's the first event that we do with Panama, and we are very eager to learn more about what is happening in this region. Have a great
And
morning.
also, sorry,
Gracias.
before we go, Miguel, I think that we will be sharing some of these contacts, I guess, also because Dr. Neil invited, some of the folks that put some questions up to reach out to him. So if you please feel free to do that. The more we can collaborate, the more we can co-create and create a bigger pie for everybody. So thank you very much, everybody. I appreciate it. Have a great day.
Thank you.
Absolutely. Have a great morning. Bye.